Inhaler with a spacer or valved holding chamber. Things to consider. Attempt to provide the student with as much privacy as possible, given the urgency of the situation. Procedure for medication administration. Gather needed supplies and place on a clean surface. Position student, providing as much privacy as possible. Wash hands. If student will be administering medication, have student wash hands. Check for authorization forms or record. Review the medication administration form, the medical provider form, and the parent or guardian consent form. Check for the 5 rights. Right student, correct time. The medicine container matches authorization forms and medication administration record. The dose on medication container matches authorization form and records. The medication is in the correct route as identified on medication container, authorization forms, and medication record. Ensure that the medication has not expired. Make sure the inhaler and spacer are free of foreign objects. Shake the inhaler for 5 seconds to mix the medicine. Remove the cap from the mouthpiece. Prime the inhaler if indicated. When the MDI is brand new or has not been used for a while, the medication may separate from the other ingredients in the canister and the metering chamber. Shaking the MDI will mix the ingredients in the drug reservoir, but may not produce enough turbulence to reblend the ingredients in the metering chamber. Priming, or releasing one or more sprays into the air, ensures your next dose will contain the labeled amount of medication. Place the inhaler mouthpiece onto the end of the spacer. Hold the inhaler between your index finger and thumb. Have the student stand up and take a deep breath in and breathe out. Place the spacer mask over the student's mouth and nose. For older students, spacers without a mask may be used. Follow the individual spacer instructions. Press down on the top of the inhaler once. Hold the mask over the child's nose and mouth for 10 to 15 seconds. This should allow the child to take 3 to 6 slow, deep breaths. If a second puff is ordered, there is no need to wait between puffs. The procedure is slightly different for the child using a mouthpiece and spacer, or if the child is not using a spacer at all. Check with your school nurse for specific instructions. Have student rinse out their mouth with water and spit as needed. Wash hands. Document medication administration in student's medication administration log. Follow up as needed with parents or guardian and healthcare provider. Procedure for cleaning the spacer. It is recommended to clean the spacer every 1 to 2 weeks, or more often if needed. Remove the mouthpiece and the rubber piece that holds the inhaler. Soak the mouthpiece, rubber piece, and plastic chamber in warm water and a small amount of dish soap. Rinse with clean water. Shake off excess water and dry on a clean surface in a vertical position, with the mouthpiece side up. Do not dry with a cloth or paper towel. Once dry, store in a clean container or bag. Procedure for cleaning the inhaler. Remove the canister from the actuator. Run warm water through the top and bottom of the plastic actuator. Do not boil or place the actuator in the dishwasher. Shake off the excess water. Allow the actuator to air dry on a clean surface prior to putting the canister back in.